Welcome back to our channel Nursing Career Club. Today we will discuss about home health aid, Unit 6, Elimination. The importance of various methods of caring during elimination needs introduction. Caring for individuals during their elimination needs, including procedures such as urination and defecation, is vital for maintaining their overall health, dignity, and well being. Various methods of caring play crucial roles in ensuring that these needs are met effectively. It means that good hygiene habits. Now we will talk about good hygiene habits. Foot hygiene, hair care, bathing ritual, oral hygiene, home hygiene, coughing and sneezing hygiene, hand hygiene, toileting hygiene. These all are related to personal hygiene. We can say that elimination is such a process of defecation or urination. Second one is accessibility and safety. We can help a patient to move from one place to another place. This is called accessibility and safety. Safety means if we are walking by a wheelchair, then we should use a belt, and if we are going from one place to another place, then we should be careful while walking. Now we will talk about privacy and dignity. Two important values when providing care and support are: first one is privacy, giving someone space where and when they need it, treating personal information confidentially; dignity, focusing on the value of every individual, respecting an individual's views, choices, and decisions, not making assumptions, working with care and compassion, communicating directly with the individual whenever possible. Now we will move to education. Now, education is a very important part of our life. We can we can get a knowledge throughout the education, so we should educate each and every person in our society, and they should be motivated to do good works in the society. Now we will talk about incontinence management. Understanding urinary incontinence. There are various parts of urinary incontinence. Try pelvic floor exercises. Limit your caffeine and alcohol intake. Check your medications. Wear loose clothing and avoid constricting undergarments. Stay hydrated throughout the day. Visit your doctor regularly for follow ups and exams. Plan ahead. Ensure restroom availability at locations you visit. Try reusable pads or protective briefs which provide extra protection. This is all about incontinence management. Now we will talk about environmental impact. Environmental impact is very hazardous for us. If our environment is there is pollution in our environment, then the people will also fall ill because the condition of environment. So our environment should be cleaned and our surrounding areas should be cleaned so that we can live a happy life and without any disease, without any depression. Now we will talk about psychological support. Psychological support is such a thing that when a doctor supports a patient psychologically, the doctor says to the patient that he or she will recover very soon, and the medication will fall an impact on the patient's body so that he will recover very soon. This is all about psychological support. Now we will talk about indwelling catheter care. We will talk about women and men. First of all, we will talk about women catheter. Step by step intermittent catheter insertion for women. Remove catheter from package part labia until you see urethra. Insert catheter tip into urethra and urine stream into receptacle. Make sure bladder is empty. Now we will talk about men. Step by step intermittent catheter insertion for men. Grasp penis at an angle. Insert catheter 5 cm into urethra. Breathe and relax pelvic muscles. Urine flow into receptacle. Make sure bladder is empty. This is all about intermittent catheterization. Now we will talk about suprapubic catheter caring. It is related to bladder. If we will do this thing, then our bladder should be empty and we should use urine catheters at this point of time. Now we will talk about external catheter, condom catheter care. So we should also use this external catheter to prevent our body from various diseases and infections. The principles of hygiene and sanitation while assisting patient in elimination needs. First of all, we will talk about assessment, physical assessment. Collect objective data using senses, race, wages. Validate subjective information, health history. Develop plan and care. Evaluate effectiveness of intervention. Now we will talk about toileting schedule. Our toileting schedule should be in this way. Use toilet, wipe, flush, sit down, wash hand. When we use a toilet, after using the toilet, we should wash our hands carefully and wipe our hands with the help of tissue. Now we will talk about fluid and diet management. What about our fluid and diet management? Foods to eat: cereals, pulses, fruits and vegetables, milk products, meat, fish and egg. Foods to avoid: spicy foods, caffeine, alcohol, large and heavy meals, flour and sugar. Now we will talk about bladder and bowel training. Urge incontinence, request urination, stress incontinence, pressure, overflow incontinence, reflex incontinence. This is all about bladder and bowel training. Now we will talk about skin care. How can we care our skin? Use a good moisturizer. Applying moisturizer daily for 2-3 times in a day gives much relief in psoriasis. Bath with warm water. Warm water bath can improve beneficial for the patients of psoriasis. Drink plenty of water. Patients of psoriasis are advised to drink at least 10 to 12 glasses of water to maintain necessary hydration of the skin. Eat plenty of fruits and vegetables. Patients of psoriasis are advised to eat more of fruits and vegetables like papaya, pumpkins, carrots, spinach, broccoli, etc. Avoid smoking and alcohol. Smoking and alcohol has adverse effect on entire body. It can also be worsen psoriasis. Now we will talk about incontinence products. There are several products which are related to incontinence products such as women's products, men's products, wash clothes and wipes, and skin cleaners and care, booster pads, adult pull-ups, underwear, adult briefs. These this is all about incontinence products. Now we will talk about environmental cleanliness. Earlier we have talked about environmental hygiene, that our environment should be clean and there shouldn't be any kinds of dirtiness in our environment. Our environment should be free from air, water, and noise pollution so that we can live a happy life and we can prevent our body from various infectious diseases and any other diseases which impart a deep action on our body. So our environment should be clean. Now we will talk about equipment disinfection. We can say that equipment disinfection flows through the misuse of our medical equipment. So we should clean our medical equipments on the daily basis, and we shouldn't reuse the medical equipments like syringes and gloves, medical gloves, and any other things. So this is all about equipment disinfection. Education and communication. Earlier we have talked about education, so that we should be educated and a person should educate all the family members related to health hygiene and patient care. And we will talk about communication. Now, a communication between a HHA and a nurse should be very comfortable and they should get each other and without any hesitation. The communication should be without any hesitation. If there is good communication between a HHA and a doctor, then they can treat a patient without any delay. Now we will talk about documentation. Documentation is such a thing when a patient goes to the doctor, then doctor prepares a report of the patient. This is called documentation. There is vital signs and body symptoms of a patient, and the doctor also writes various medicals for the patient, and he also instructs that at what time the patient should take medicines. This is all about documentation. Now we will talk about digestive health. We can improve our digestive health throughout using digestive food. We should intake proper vitamins and proper proteins so that we can keep our digestive health in a good condition, and we should eat fruits and vegetables to keep our digestive health in a good way. Now we will talk about dietary factors. There are several dietary factors: cigarette smoking, age, gender, genetic factors, race and ethnicity, obesity, hyperlipidemia, hypertension, alcohol intake, overtaking unhealthy foods. This is modifiable risk factors. These are modifiable risk factors. This is all about dietary factors. Now we will talk about the importance of color and texture change of urine and stool. Gastrointestinal bleeding. Now we will talk about gastrointestinal bleeding. So, gastrointestinal bleeding is a sign of a disorder in the digestive tract. The blood often shows up in stool or vomit but isn't always obvious. Peptic ulcer. This is the most common cause of upper GI bleeding. Peptic ulcers are often sores that develop on the inside lining of your stomach and the upper part of your small intestine. This is all about gastrointestinal bleeding. Now, how this incident occurs: upper GI bleeding, above ligament of threads causes peptic ulcer disease, erosive esophagitis, esophageal various AVM, Mallory Weiss syndrome, cancers of the upper GI tract. Now, below ligament of threads causes diverticulosis, hemorrhoids, colorectal cancer, AVMS, intestinal ischemia. This is all about gastrointestinal bleeding. Now we will talk about infection or inflammation. Infection is disease by a specific invading microorganism, virus, bacteria, parasite, etc. So infection, how a infection flow in our body. It is generated by diseases such as virus, bacteria, and parasites. They leads various diseases into our body so that we fall ill. And if we get in connect with a patient, then we can also be an infection disease. Now we will talk about inflammation. Inflammation is the body response to an irritation which may be infection, chemical or autoimmune. Now infection flows throughout the virus, bacteria and parasite, and inflammation is such a thing which is in response of irritation when we are in a depression and when we are irritated, then it can be a path of infection, and any types of chemical can arise in our body and we can fall in ill, and our body can be infectious in that situation. This is all about infection and inflammation. Now we will talk about medication and supplements. Medication. We should take a proper medicine according to the advice of a doctor. In what quantity we have to take medicine, at what time we have to take medicine. This should be under the advice of the doctors. Now we will talk about supplements. Are such things that we take in our daily food, in our lunch and in our dinner, like various fruits and vegetables and our food also. These things are supplement things. Now we will talk about bowel obstruction. Bowel obstruction is such a thing that it is related to our body. When we vomit on or defect something from our body, then the situation of bowel obstruction creates green bilious vomiting, small bowel, adhesion, tumor, large bowel, blockage, fluid, distended lobes. This is all about bowel obstruction. Now we will discuss about presence of blood. The presence of blood in urine is called as hematuria. It is defined as the presence of red blood cells in the urine. It can occur from any part of the urinary tract, kidney, ureter, bladder, or urethra in men and women and children. Bright red blood in your stool usually means that bleeding is lower in your colon, rectum, or anus. Dark red or maroon blood can mean that you have bleeding higher up in your colon or your small intestine. Melina, black stool often points to bleeding in your stomach, such as a bleeding stomach ulcer. This is all about the presence of blood in our various parts of our body and what is the vital sign of the presence of blood. Now we will discuss about adult diapers, incontinence, briefs or undergarments. Instruction for use and disposal. Pull on like a regular underwear, roll up from bottom, tear away the side seams to remove. Dispose responsibly, do not flush. Now we will discuss about bedpan. Bedpan is such a equipment which is used to intake the food and we can put our food in the bedpan. So bedpan is very important for us to intake food. Now we will talk about urinal male and female. There is a urinal pot for the male and female. And we will talk about commode chair, 3 in 1 commode. Commode chair is such a thing through which a patient can sit on the commode chair and he can pass his or her stool, or it means that he can defecate easily at this chair. So this is a versatile design. There are very versatile designs in the commode chair. So it is very useful for the patients who cannot move from one place to another place and they are unable to go in the bathroom. So they can use this chair. This is all about commode chair. Now, what are the comforts of the commode chair? Comfortable and secure, crafted designs for a better use. Padded armrest, soft cushion seat, waterproof, non-slip rubber foot. These are the various factors and various parts of a commode chair. Now we will talk about preparation. We should be prepared to fight with a disease. If our immune system is very strong, then we can live free from various diseases. It depends on our digestion and on our food intake. That which type of food we take intake. If our food is very without any infection, then we should be prepared to fight with the very disease. Now we will talk about communication and consent. Consent, we can say consent in another words acceptance. If a person is pleased with us, then we can say that he is consent with us. And we will talk and now we will discuss about communication. So communication is such a thing that we send messages and we speak some words to another person and he listen our words, that is called communication. Our communication should be very effective with each other and between the HHA and doctors. Communication should be very effective so that a patient can recover very soon. This is all about communication and consent. Now we will talk about transfer. Transfer is such a thing that when we when a HHA take a patient from one place to another place with the help of wheelchair, then he should put the side belt so that patient can sit on the chair without any fear, and this is the way to transfer a patient from one place to another place. Now we will discuss about positioning. There are various types of positioning. First is Trendelberg position, supine position, prone position, lateral position, lithomy position, Fowler position. This is all about positioning, and we should do this positioning in the accordance of doctor's advice. It is very helpful to keep our body healthy. Now we will talk about privacy. Privacy is such a thing that when a patient is admitted to admitted in a hospital and he or she needs to be get changed their clothes, then a proper curtain there should be proper curtains in the surrounding area of the patient so that he and she can change his or her clothes at any time. So this is related to privacy. Now we will talk about assistance with toileting. Now a HHA help a patient in the toileting. He can take the patient in the toilet room and he can remove his or her clothes and help him in the defecation and urination. This is all about assistance with toileting. Now we will talk about safety. Patient safety goals. Identify patients correctly, improve effective communication, improve the safety of high alert medication, ensure correct site, correct procedure, correct patient surgery, reduce the risk of health care associated infections, reduce the risk of patient harm resulting from falls. Now we will talk about documentation. We have earlier talked about documentation. That documentation is such a thing when a patient goes to the doctor and the doctor prepares the documents for the patient, such as vital signs and body symptoms. And the doctor also mentions on the document that which types of medicines the patient have to take, and AHHA also helpful in the documentation. Thank you for watching our video. I hope that this is a very helpful video for you. If you want to ask a question, then you can comment in our comment section, and if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Now thank you again. We will see you in the next video.